Let's talk about the tools for a little bit because I always, love to hear how other practices, and especially in the biological world, are utilizing the tools or what they're seeing and in the trends. Because over time, things change. I think we could agree that more and more people are exposed to more toxins than ever, so they need more detoxification. We're exposed to many
Sure.
emotional things. We might need that as well. If you were to take the 80-20 principle here, Pareto principle, and say, all right, 20% of these tools I'm using in about 80% of the population. What would that be? What would those tools be that you're seeing at least?
I mean, I still like lymphatic treatments and
Yep.
we do a lot of nervous system stuff.
Mm-hmm.
So like full brain TMS, like
Mm,
neurostims, like frequency therapies to settle down nervous systems. And like you
mm-hmm.
said, the detoxification stuff. Like I'm always interested in complicated things, right? Like, so I'm interested in making cells do better things and doing hypoxic training and hyperbarics, like
Mm,
doing all the spectrum of stuff. But if you just had a clinic that you did like these days, that you did lots of central nervous system treatments, like you could see a miraculous amount of things get better. And if
nice.
you have a clinic that just does lymphatic treatments for
Yeah.
detoxification, and visceral like you can see, especially digestive stuff and autoimmune stuff, you can see a lot of things. Now we have V cells and all these other fancy EBO2 and blood filtering, like we have all these fancy things. But as the world gets more complicated, if you can get the blood filtered and the lymphatic system cleaned up, and you can reset nervous systems and light brain pathways up, and you can do some like fantastic things. And I think everything is evolving, but you need, like, unfortunately for these conditions, you need fancy treatments because they have to be like, that there's it's not easy anymore, right? The people want results fast, and everything is like so deep that you need to have a lot of therapies. And people always like question when I say, like, you can't just take supplements. Supplements are not therapies, they're supplements. Like, you need
Right.
therapies. Supplements that help, hormones help, peptides help,
Yeah.
but you need to, before you plant those seeds, like, people are like, oh, you're going to give me some hormones? I'm like, yeah, after I like make sure that we plant this so the hormones work. Like, why do a treatment if the treatment's not going to work? And so,
Right.
like, a lot of these things are like, you need to clean, like, change the oil first before you're going to drive the
Right.
car faster. People are like, well, why do I need to do that? It's like, because it's physiology. Like, how do you expect not to do it? Right. Like, so I think cell therapies are really interesting because, like stem cells, exosomes, V cells, like these things, because cells, like, they need help now. Like, they didn't used to. They used to, like, you clean the environment before and the cell could kind of do, mitochondria could kind of do things.
Yeah.
And now, like, all those cells need like extra help, extra resources. Like, young cells do young things. Like, everybody needs a lot of ability to regenerate, to catch up,
Mhm.
to where the environment, where they've lost these years. And all these mitochondria need extra oxygen and hypoxic training to recycle the old ones. So it's fascinating now because you need to actually, like, these are like race cars now where you need to do things to the race car, and then the car drives beautifully. But like, the treatment modalities end up to be definitely more extensive than they used to be. But I mean, the results, the more things that come on the market that you adopt, like, once you have a base, they become fantastic. Like, the results are fantastic. I'm a patient myself here,
Mhm.
so like I'm doing stuff all the time, and like you get to feel that result. And I think that's like, people buy into that when they get to see a big change.